Hello, this is Andre doing the voice and Kelsey doing the video editing, and we will analyze our running today. So at first look, Kelsey does have a forward angle lean of about 11 degrees. Andre's running form includes a forward lean of 18 degrees. The forward lean of the whole body is correct, helping in increasing the running efficiency with the slight help of gravity. It is important that the leaning is not initiated from the waist, but the whole body from ankle to shoulder. This promotes efficient hip extension for stronger forward propulsion of the legs. It can be observed that the forward lean from Kelsey could be better by thinking of keeping the hips forward or tucking the backside under the hips. Tight quadriceps and hip flexors encourage forward lean from the waist, and proper warm-up with stretching can avoid this. Too much of a bend in the waist could lead to pressure and pain in the lower back. Andre, on the other hand, has a good forward lean utilizing his whole body. Kelsey and Andre both gaze perfectly forward, ensuring that there is good alignment so that there's less stress on the neck and shoulders. Kelsey's torso is also in line with the neck and is straight. This proper upright position promotes optimal lung capacity for deeper breaths. Andre's torso, on the other hand, is not very aligned with his neck. This slight slouch would prevent efficient breathing and may lead to neck and upper back pain. He should keep his back more aligned and straight by thinking of slightly pulling back his shoulders and pushing his chest forward. Both their front feet also land in front of their faces. However, both can afford for a front step slightly more ahead of face for further stride for faster speed. This can be done by thinking of driving the front knee up faster. Observing the hip alignment with the body, Kelsey's hips are pretty much in alignment, allowing for maximum takeoff and preventing unnecessary effort from being wasted during push-off. Andre also has a slight but not significant difference between hip alignment and body alignment, about 8 degrees. By ensuring that he is not slouching and keeping his back aligned and upright, less effort will be lost while running for greater efficiency. Before takeoff, it is seen that the back leg of Andre and Kelsey is almost fully extended, allowing for maximum power to be exerted for takeoff. Here, we observe the level of bouncing during the run by measuring the highest and lowest point at which the eyes reach for both runners. The difference in eye level only differs to about the height of their hairline, indicating that there is no significant bouncing. This shows that more of the force is used in moving forward instead of being wasted in an up and down motion. This is efficient and good. Next, we analyze the angle of the shin before contact with the floor, also known as the shank angle. The runner with a large shank angle usually hits the ground with a straight leg, with the landing foot well in front of the body. In contrast, the runner with a small shank angle hits the ground with the foot closer to the body and with a more flexed knee. Good running form is a small shank angle of about 6 to 8 degrees. For Kelsey and Andre, both runners have slightly large shank angles. This places the shin bone and surrounding anterior muscles under a huge amount of stress, as landing forces are not absorbed and transferred into the forward momentum efficiently. Hence, runners are more susceptible to injuries such as plantar fasciitis, shin splits, and anterior compartment syndrome. To correct this, we can increase the cadence to about 170 to 180 steps per minute. Runners should avoid overstriding by actively thinking about where their foot is landing during running and concentrate on taking shorter strides. Continuing, we see the angle of the knee upon initial contact with the ground. For both Kelsey and Andre, both correctly lands with a bent knee. This cushions the impact of the ground to their knees and therefore prevents injury to the knee. While the front foot lands, we observe the trailing leg. The trailing leg for Kelsey reaches 84 degrees and 88 degrees for Andre. Both trailing legs have knee flexion, which is good. Both runners' heels are not close to the butt. This does not cause injury, but ideally, the heel should be closer to the butt. The faster the thigh moves backward during running, the more the back leg pulls up to the butt. It's simply an inertial force generated while running. Once the thigh is extended as far back as it is going to go, it then shoots forward like a slingshot. Hence, we should aim for a small knee flexion angle, with the thighs as far back as possible. Runners can improve this by actively thinking of pulling their back leg faster. Next, we draw a horizontal line as a hip marker to analyze the hip movement. Both Andre and Kelsey's hips do not deviate from the line much. This is good, showing that there is more horizontal than vertical drive, hence more efficient running. Arm swing is very important in running, especially in affecting the rhythm of the run. Both runners' arms are definitely not flopping around. It is good that both runners bend their elbows and concentrate on the arm drive while still being able to relax their hands. This helps in balance. Kelsey has an elbow bend of 40 to 50 degree bend, while Andre has an elbow bend of about 100 degrees. Although it does not cause injuries to vary from an elbow bend angle of 90 degrees, it is more efficient to stick to an angle of 90 degrees or closer to help increase the efficiency of their running, with greater propulsion enabled using the arms. Both runners also have sufficient arm swing, where the wrist stops around their waist. This is good, since ensuring elbows are behind the runner's hip help in better posture. For most of the time, Andre's front foot lands with a forefoot strike. Kelsey, on the other hand, has a heel strike. Although studies shown that there is no definite right or wrong method of landing using forefoot, midfoot, or heel strike, it is recommended to use a forefoot or midfoot strike since it allows body weight to be more evenly distributed to the ankles, hips, backs, and knees. On the other hand, heel strike has a higher tendency to put more strain on the patella, calves, and hips, causing pain and injury. Kelsey has also complained of knee pain during and after runs even at rest, along with tight and sore calves. This could be caused by her heel strike. To fix this, she should also focus on changing to midfoot or forefoot strike by actively thinking of the landing during runs, starting off slowly. Before landing, Andre's foot is at an open angle of 104 degrees with plantar flexion instead of dorsiflexion. Kelsey, on the other hand, has dorsiflexion at about 70 degrees, which is ideal in absorbing shock. Some injuries that Andre might have include shin pain, knee injuries, and plantar fascia issues. To solve this, firstly, we have to ask him to consciously have dorsiflexion during running. Some other exercises that can help include single leg isometric dorsiflexion holds and dorsiflexion with a resistance band, since poor dorsiflexion could be due to a lack of flexibility. During running for both runners, it can be seen that both feet are off the floor at once, which is good. Both also have a good high knee lift, which can be seen by the parallel lines drawn between both legs, about 90 degrees for Andre and 120 degrees for Kelsey. Kelsey can afford to drive the knee more to close in the angle nearer to 90 degrees. The high knee lift allows them to have better cadence and a more efficient stride length. Gait analysis can be done by drawing a line from the middle of the glute to the knee and the heel. A line drawn for both Kelsey and Andre is 180 degrees. This shows that the leg moves straight, back, and through. This is excellent. Next, we observe the pronation of the runner's feet. In this position, the foot rotation can be analyzed. Kelsey has a slight outward foot rotation. That should not be of a concern. Andre seems to have a more significant outward foot rotation. Over time, it can lead to injuries such as plantar fasciitis, shin splits, runner's knees, hip bursitis, hamstring tendinopathy, and lower back pain. To correct this, exercises must be done to increase hip stability, hamstring, adductor, and soleus, such as leg presses and calf raises. Analyzing the pronation of the feet, Kelsey and Andre can be observed to have overpronation in only their right foot. This occurs when the foot is planted and it rolls inward excessively, transferring weight to the inner edge instead of centering it on the balls of the foot. This causes running to be very hard and painful, and it is very stressful to knees and feet. A lot of force is traveling up the body, which makes landing very painful. Both runners might develop pain and discomfort in the ankles, Achilles tendons, shins, knees, and heels over time. They should ensure they are wearing well-fitting pair of shoes and do exercises to strengthen their arcs, such as toe raises, calf raises, and heel stretches. Drawing a line at the waist of the runner from the back allows us to see if the runner has any hip drops. Both runners' hips stay parallel with the line, showing that their glutes are successfully acting as stabilizers. Lastly, from the anterior view, drawing a line at the waist of the runner confirms that the hips do not drop, and drawing a line from the hips to the knees and the feet show that there is no caving in of the knees, which is good. Thank you.